Hello friends, welcome to YouTube channel Health Q, the place where my mission is to not only motivate you but take you to the bright side of the hill. As you guys all know, we have launched our Health Q Rehab various programs for rehabilitating different conditions that affects your ability to move independently. And one such rehabilitation that we are proud to say have incorporated in our rehab program is vestibular rehabilitation. So what is vestibular rehabilitation? I'm going to talk about that in this video. So if you who are someone who experience dizziness on a very regular basis, if you who are someone who have repeated spinning or else problem like vertigo, then this video is definitely for you. So make sure to stay with us till the end. Let's begin. Friends, vestibular system is one important system in our body which helps us to maintain balance. Yes, balance is one such important function that we usually neglect or ignore. But when it gets affected, your life becomes miserable. And we see this with our patients always. How difficult it is to live a normal life when your balance is impaired because you feel you are constantly falling or else everything around you feels unstable or shaky. Now imagine yourself being in such situation, how difficult it would be, right? And you would want to correct or else get out of this problem as soon as possible. And when you want to get this, then definitely vestibular rehabilitation helps you. To make you understand this, it's important to know what exactly is vestibular system. Well, balance is a sensory system or is a sense in our body which gives us an assurance that we are stable in an area which surrounds us. Now this balance is controlled by two centers. One in the brain, which is your balance center you can say, and another one called as vestibular system or else your vestibular organ which is present in your inner ear region. This vestibular system makes sure that your normal postural control is maintained, which means you are able to balance yourself normally without any problem. You don't fall repeatedly, which is the most fundamental activity of daily living. When your vision, your somatosensory system, which means your touch sensation and your muscles and your inner ear system, when they three combine together, they communicate with each other, they give feedback to each other, and based on this feedbacks, you get the sense of stability. But when your vestibular system is impaired due to some sort of pathology, there is an imbalance due to which you experience imbalance in your ability to do your day-to-day tasks as well. Now, the problem can be either with your vision, the problem can be with your somatosensory system, or the problem can be with your vestibular system. When all of these three systems are working properly, at that time only you would be able to maintain your balance. But when either of the system gets impaired, your ability to balance also gets impaired. And one such problem of balance that people usually experience is vertigo, where the problem is in your vestibular system or is the system that lies inside your ear. Now, when a person suffers from vertigo, the common symptom or else experience that the person have is that everything around it is moving or else he is moving in relation to earth. That sense of spinning is one of the typical symptoms of vertigo. This problem usually happens among 1 in 5 people between the age group of 18 to 64 years and is commonly seen more in women compared to men. And the biggest problem is 40% of people who experience this vertigo don't ever go to doctor. They feel this is some real problem which will just go on its own and it does not need any intervention. But eventually what happens is when this kind of increase over a period of time, the patient's ability to do day-to-day activities gets impaired. Now the pathology why this happens, what happens inside the ear is little tricky to understand. So to make you understand in a very simple way, I can say it in that way that your vestibular system or else an organ that is present inside your ear has 3 different areas. Now in these 3 different areas, there are few different structures. Okay. Now whenever there is imbalance or disproportion or else absence of few structure due to aging or due to any pathology, at that time there is an imbalance that is present and that system don't work the way it is supposed to work. And when that happens, a person starts experiencing vertigo. And the most commonest form of vertigo is usually this form, which in medical terms is called as benign paroxysmal positional vertigo, which means benign means it stays for a short period, where benign means that it is incurable or is an controllable problem. Paroxysmal means a vertigo or else dizziness that stays for a very short period of time. Positional means this vertigo or this dizziness is triggered by change in movement, and vertigo in itself means dizziness. So this entire problem is the commonest reason why you can experience vertigo symptoms or else dizziness symptoms. As I mentioned, the reason why it happens is a little tricky to understand, because to understand that you need to understand the entire anatomy and physiology of your vestibular system. But to make it simplify, I can tell you this, that your vestibular organ which is present inside your ear has got some imbalance issues, have got some problem. This problem can be either genetic, sometimes due to no reason or no cause, sometimes due to an injury that has happened previously, and sometimes just following an other central nervous system problem like brain tumor or else stroke, etc. Now, in order to make diagnosis that you have BP, PV, vertigo or not, your doctor or else your physiotherapist will take your history, will try to understand your symptoms in a very detailed manner, because there are many different conditions can give a very similar picture. So here the differential diagnosis is very important. Along with that, they will ask you to do some positional movements which will help them identify what is the cause or reason behind your vestibular vertigo. After that, they will also suggest some scans like CT scan or MRI and some blood tests to identify is there any infection or any other problem present inside the ear or not. And once that is done, then the final conclusion that yes, you have got a benign paroxysmal positional vertigo will be made, and based on that your treatment will start. Now treatment is not only medical but is physiotherapy management as well. Now in physiotherapy management, the focus is on few aspects of your dizziness. The first is to improve your ability to focus, because there is some imbalance and there is some dizziness. You can't stay or else maintain your head and body in a focused way, in a steady way in one position, and that's why gaze centering or visual fixation exercises are given. After that, there are some habituation exercises given where you learn to adopt different positional changes which are initially triggering symptoms of vertigo but over a period of time will reduce. Next is improvement of your balance stability. This is done with the help of more of balancing exercises, so that the compensatory mechanism, for example, if your vision is intact, if your somatosensory system, which means your bones, muscles and joints are intact, then to make them strong so that they can help your imbalanced area in the ear to overcome the challenges and thus allow you to live a very easy and steady lifestyle. But on top of all of these things, the most important piece here is education of yours. It's very important for you to be part of this rehabilitation process. This is not going to be a passive process where what we do and just that is done and everything is okay. No, there's a lot of lifestyle modification that is needed, and that lifestyle modification has to be continued over a period of time. When you continue this lifestyle modification along with a gradual progressive exercise and like your positional changes, that reduces the risk of vertigo as much as possible. At that time, your vertigo symptoms will come under control. And sometimes along with this, there can be some other external and extra problems, like if you have neck problem, your neck issues are there, if you have back problem, even those areas needs to be addressed, because they also somewhere indirectly affect your vertigo. And that's why an entire assessment is needed, and based on that assessment, the entire rehabilitation program is designed for you. And that makes an vestibular rehabilitation for vertigo. Now, I tried my best to simplify the process of making you understand what is vestibular rehabilitation. But as I said, 40% of people who experience vertigo or dizziness don't report. Please don't do that mistake. Make sure to take help, reach out to your doctor or some physiotherapist, and make sure to start your vestibular rehabilitation as soon as possible. By the way, we provide vestibular rehabilitation on our HealthQ Rehab platform. So make sure to check it out. The website link as well as our app link is mentioned in the description box below. So you just click and book your slot and start your journey of vestibular rehabilitation. On that note, I'll end this video here and I'll see you in another video. Thank you.